Assalamualaikum and a very good evening to my supervisor, examiner, and my fellow friends. My name is Ahmad Sahadan bin Tahip, and my student ID is 9502-17112-6499-001. I am currently a student in the Bachelor of Medical and Health Science program from the KK Kota Kinabalu Learning Center. Today, I will be presenting a case study entitled Ergonomic Safety in Clinical Practice, a case study on wound care management. This presentation reflects on my clinical experience at Klinik Pusat Koreksional Labuan, where I work there, and specifically focusing on how we handle wound care management to reduce musculoskeletal risks. Occupational safety and health, or OSH, is often thought of as just wearing a helmet or glove, but in the clinical settings, especially in correctional center, it goes much deeper. It involves the decisions we make every day about how we use our equipment and how position our bodies. Over the next 15 minutes, I try 15 minutes, I will walk you through a specific trigger events involving a patient with a heel wound and how correcting simple habits changed the safety culture of my shift. All right, let's begin with the basic. What is ergonomic? Simply put, ergonomic is the science of designing the work to fit the worker rather than forcing the worker to fit the task. In a healthcare setting, this helps improve staff comfort, efficiency, and overall health. Working in a correctional center clinic is a physically and mentally demanding. We deal with the unique patient and high volume workflow. Reflecting on my experience during my duty at there, I realized that OSH is not just a cheery villain. In class, it is a vital practice. When we apply a proper ergonomic, it benefits everyone. Do the staff go home without back pain, and the patient receive higher quality care because we are focused and comfortable. Okay, why does this matter specifically in our clinic? First, even though we have a clinic, the space can be confined. We perform repetitive tasks like dressing wound, checking vital sign, and dispensing medications hundreds of times a week. This repetition can lead to cumulative fatigue and musculoskeletal strain. Secondly, the mental stress is high. We have to make fast decisions while maintaining security awareness. When you combine mental stress with physical pain from a bad posture, the risk of burnout increases significantly. And finally, patient safety. If a medical assistant is in a pain or tired, they are more likely to make error. So good ergonomic is actually is patient safety strategy. Okay, now let's move to the core of this case study. The trigger event I attended to a male inmate who came in with a deep infected wound on his right heel. This was not a simple scratch. It required extensive dislodging, which is through cleaning process that take about 15 to 20 minutes. Okay, now here is the critical part in our clinic. We actually do have height adjustable bed, and in this specific case, the patient was not handcuffed, so he was free to move. However, the habit or the culture in the clinic is often to treat patient right away where they sit, even if the patient sit on the wheelchair. Because we think, oh, it's just a dressing, I will just bend down and do it. So I realized that if I follow this habit, I will have to bend, double, and twist my neck to see the bottom of his foot for 20 minutes, even though the right equipment, the adjustable bed was right there and the behavior was the risk. This event highlighted the challenges we face at the clinic correctional center clinic. The biggest challenge is not always the lack of equipment. As I mentioned before, we have the adjustable bed. The challenge is behavior. It's the quick fix mentality. We often think that taking 2 minutes to transfer patients, it was the time, ignoring the fact that working in pain slow us down later. So we also deal with the crowd space and cognitive load. When the clinic is full of inmates and officers, we just want to clear the queue. This pressure leads to the underutilizations of our ergonomic tools. We have the technology, but we fail to use it because we were rushing. So, how did I address this? I implemented a specific strategy for staff safety. First and foremost, I utilized the equipment. I made the conscious decisions to transfer the patients from the wheelchair to the bed. Since he was not handcuffed, this was a straightforward process, but it required me to break the habit of rushing. Once he was on the bed, I used the hydraulic control to raise the bed, and this is the most important step. I Important step. I raise it until the patient foot was level my waist. This allow me to maintain a neutral posture, standing straight, shoulder relaxed, and no bending. I also encourage teamwork. I ask a colleague to help position a wedge under the patient leg. This small pause to set up the environment completely remove the physical strain from the task. Strategy for patient comfort. Okay. Ergonomic is not just about me, it's also about the patient too. By moving the patients to the bed, we improve patient comfort. Sitting in a wheelchair while someone digs at your heel is uncomfortable and unstable. So lying face down, I mean prone positions on a padded mattress with the legs supported by a wedge, allow the patient to relax. This positioning reduces his pain because his leg was not shaking or slipping. It also gave him a sense of dignity and safety. He was being treated like a patient in a hospital, not just inmate in a chair. Additionally, because he was stable, I could clean the wound more truly, leading to a better hygiene and faster healing. Okay, workflow and environment. Beyond the bed, Beyond the bed itself, I look at the wider workflow and environment. I apply the principle of organizations. So before I start the dressing, I pull the trolley close to the bed within arm reach. This prevents me from twisting my back and forth to grab gauze or saline. I also focus on planning. I establish a personal rule before I put my sterile glove. I must do an ergonomic check. Is the bed high enough? Is the light focused? And is the trolley closed? This simple mental checklist reduce unnecessary movement and cognitive overload during the actual procedure. Benefit of ergonomic strategy. What were the benefit of this strategy? The difference was night and a day. For staff safety, I finished a 25-minute procedure with zero back pain and zero neck fatigue. I felt fresh and ready for the next patient. For efficiency, even though taking the time to transfer the patient took an extra 2 minutes, the actual dressing was faster because I was not struggle to see wound. For patient quality, the visibility was perfect. So the wound was cleaned 100% effectively. It proved that small changes, like simply pressing the button to raise the bed, make a massive difference in our professional lives. So next, reflection and growth. Reflecting on this, I have experienced significant personal growth. I used to think that as long as the job done, it was fine. Now I am hyper aware of Microergonomic. I realized that having equipment is useless if I don't have the discipline to use it. I have started actively choosing safety over speed. I also find myself advocating for this to my colleague. When I see my colleague bending over a wheelchair, I gently remind them, hey, use the bed, save your back. I know, I now view ergonomic as a core part of my professional responsibility, essential for sustaining a long and healthy career in healthcare. In conclusion, this case study at Klinik Pusat Koreksional Labuan taught me that ergonomic is essential. We faced a situation where the risk was not the lack of equipment, but the failure to use it due to a culture of rushing. By breaking the habits, by moving the patient and raising the bed, we achieve a safer outcome for the staff and better outcome for the patient. Occupational safety and health is not just about avoiding accident, it's about optimizing how we work every single day. My commitment to this ergonomic principle will continue through my career. And lastly, this is my reference I used to support the ergonomic principle discussed in this presentation. So I thank you for your attentions. Goodbye.